Hello, I'm Dr. X or Dr. working here today. May I confirm your name and age, please?
Hi, doctor. My name is Erika Phillips, and I am 30 years.
Yes. How may I address you?
Please call me Erika.
Okay, Mrs. Erika. May I? Okay, Erika. Today we are going to discuss about your health issues. Will that be all right?
Yes, doctor. Okay.
During our conversation, I might take down some notes, which will be strictly confidential. Is it okay?
No problem, doctor.
Okay, Erika. Can you please tell me in your own words what have brought you here today?
Okay, doctor. Actually, I am not feeling well for the last 1 month. I noticed that I have some night sweats, and they are so severe that sometimes I need to change my clothing. I got to wet my clothing at night, and for this, I visited my GP twice. And time I was first time he asked me a few questions and thought that there was some problem with my water work. So he thought that there might be some infection in my water system. So he gave me antibiotic. I took that for 5 days, but that didn't help me. Then after a few days, I again visited him, and at that time he changed the antibiotic, and that second antibiotic helped me a little bit, but I am not feeling well though. So I again asked him that if I need any other medical attention. Then he thought that there might be something abnormal, and also I have a history of some problem in my heart valve. So he thought that I may have some abnormality with that, and for this he sent me here.
Yeah, okay, I get it, and I will try our level best to crack down the problem. Okay, and may I know that you if, you have been unwell for the last 1 month? Can you please tell me that did the fever or the raised temperature come really?
Hello.
Yeah, yeah. Can you please about did it come suddenly or gradually? What do you think about it?
uh I cannot tell you yet exactly, but I
Yeah,
think
yeah.
that I felt the problem. Initially it was actually for the last 6 weeks I felt some fatigue, some weakness, and for last 1 month I am having this fever, or I cannot say it is fever, but sweating at night.
Sweating at night. Okay. So you don't usually notice some any raised temperature. You were telling.
I cannot tell you surely that I have it on,
Okay, okay,
but I think
okay. That's all
that
right.
I may have some raised temperature.
Okay. You haven't ever measured it. Have you ever measured it?
No, no.
Okay. And you told that you have there some sweating, and can you please tell me that is there any loss of weight? Have you noticed any?
Sorry.
Okay.
Can you please repeat again? I couldn't hear you.
Yeah, yeah. Have you noticed that is there any changes in your weight that you are getting that your clothes are getting looser? Anything like that?
Yes, yes, doctor. That is another issue that
Okay.
uh, for about last 2 months I am losing some weight, and I might have lost about 5 pounds over this time.
Okay. And may I know, is it intentional or unintentional?
No, I didn't have any issue that I have to lose weight, but I have
Oh,
also reduced appetite. I cannot eat like before.
okay. So you also have reduced appetite. Okay, I get it. May I know that you told that you went twice to the GP and he found some problems in your water work. Well, can you please tell me that did you feel any problem with your water work? Like, did you have any pain while while doing your water work?
No, no, no pain, doctor. But my watercolor was somewhat darker. and
Okay.
no
Okay.
pain or no redness.
Okay. For how long did you notice this?
Maybe for last 1 month or maybe somewhat a little bit more. I cannot tell you exactly.
Okay. 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 And now, what about now? Is there any change now in the color?
No, it is
Okay.
it is same.
It is same. Do you feel that you have to go more frequently for your water work
No,
for the last 1 month? Okay.
no.
Uh, okay. And do you feel that there is any poor stream in your water work, or is it okay?
It is okay, doctor. Just some changes in the color.
Okay. Okay. And do you have any tummy pain or any pain in your groin region?
Uh, I have pain, doctor. Tummy pain on my left side.
On your left side. Okay, that's all right. All right. Can you please tell me when did the pain started?
This pain also came for maybe last 3 to 4 weeks.
Just 2 to 4 weeks. Okay. And has it been all this? Did it come along suddenly or gradually?
No, gradually. This pain is not so severe, but some achy pain.
Okay. Achy pain. Okay. And does it radiate to any other pain, any other site?
No, it's always on my left side.
Okay. And okay. And do you feel that there is anything that makes your pain worse?
No,
Okay. Anything makes it better?
no,
Okay. And may I know that okay, may I know that is there has there been any color, any changes in your nail or skin recently?
I haven't noticed it, doctor.
Okay, that's all right. And and may I ask you some other questions now? That you told that you have some night sweats. Do you feel any headache?
No headache.
Okay, and any changes in vision?
No,
Okay, any soreness in your mouth?
no,
Any rashes anywhere in the body?
no,
Okay, and any joint pain?
no,
Okay, any changes, funny color changes in your finger?
no. I haven't noticed.
Okay, and well, do you told that you had some heart issues previously? Do you know what the heart problem was?
Yes, doctor. I I was born with defect in a valve that is called aortic valve, and they said that
Okay,
there are some two valve. Normally it has three valve, but I have two valves, and then
okay,
I have went and undergone a surgery for this because I had some symptom. And at first, at my
okay,
when I was a child at age 3, I had
yeah,
some dilatation at the valve. And
okay,
about 5 years ago, I needed a valve replacement surgery, a mechanical valve, and I also can hear the
yeah.
sound for the valve.
Okay, okay. So since you took that some valve, so after that operation, have you been on any medication?
Yes, doctor. I was given blood thinning medication that is warfarin, and I take that regularly.
Okay, and well, do you regularly monitor your iron level? I think you know the term since you have been on warfarin.
Yes, doctor. It
Oh,
is within the normal limit.
okay, when did you last check it?
About 3 months ago.
Okay, and okay, and it was in the normal limit. Okay, and can you please tell me that do you now feel any chest pain?
No,
Okay, any racing and pacing of your heart?
no,
Any shortness of breath?
no,
Okay, any swelling? Any leg swelling?
no.
Okay, can you tell me that do you have any cough?
No cough, doctor. But shortness of breath, I can tell you that I feel it when I do some moderate exercise. That time I didn't feel it before, but I am feeling
Okay, when did you start feeling it?
for maybe for last 1 month or 1.5 month.
Last 1.5 months. Okay, and okay. And can you tell me that do you having cough? You told no. And any chest tightness?
No.
Any noisy chest?
No.
Okay. And what about your bowel movements? Can you please tell me?
It's more or less same before.
Okay. And now I'm going to ask you that some family history. Do you, anyone of your family has any known chronic disease, long term diseases?
My father also had a valve problem, heart valve problem.
Okay. Heart problem or valve problem? Can you
Valve
please
problem,
specify?
doctor. Valve problem.
Okay. And how was it treated? Can you please tell me?
He also needed a valve replacement.
And how is it doing now?
He's fine, doctor.
Okay. And okay. And can you please tell me that may I ask you some personal questions? Can you please tell me that do you smoke?
No, never.
Okay. Do you drink alcohol?
No, never.
Okay. Do you take any recreational medication?
No, doctor. No.
I'm sorry to ask. Okay. And you have told me that you have taken this alcohol, and sorry, you have been taking warfarin. And do you take any other medication apart from the recent antibiotics?
No.
Okay. And may I know that have you ever undergone any surgical procedure recently, like any problems in your teeth, any dental procedure?
No.
Okay. And okay. And can you tell me that okay, have you been to travel to any country recently?
Uh, Not recently. That was about 1 year ago.
Okay. Can you please tell me where you went?
Yes, Spain, doctor.
Spain. Yeah, Spain. Okay. And can you please tell me that uh, in Spain, where did you stay? In countryside or in the cities, or what did you do?
I stayed in a city and always was in a five-star hotel.
Okay, and in a five-star hotel. Okay, I get it. And can you please tell me that whether do you had any swim in any pool or something like that?
There was swimming pool. We used it.
Okay, you used it. Okay, and okay, and did you take any prophylaxis for any local authorities for any local diseases? Can you remember of any?
No, it was in good condition. We didn't need any prophylaxis for any medication for any
Okay,
condition.
that's all right. Okay, that's all right. And okay, and yeah, and can you please tell me that did you during that stay did you had any casual relationship? I'm very sorry to ask this, but we have to ask these
No,
questions
doctor,
actually. I'm
never.
sorry.
I am married for 8 years and I am living with my husband.
Okay, that's all right. And that's all right. And well and may I know what your concerns are?
Yes, doctor. My doctor, my GP suspected that it was some problem in the water work, and he also suspected that there might be some problem with my heart valve. So actually, what
Okay.
is?
Yeah, yeah. And may I also know one thing that do you feel any lump and bump in your tummy or anywhere in the body?
No.
Okay, okay. Actually, as long as I have taken your history, it's not. It's difficult at this moment to uh, say what is causing your symptoms. But we can actually tell you more precisely after examining you properly and evaluate and assessing you through some by doing some blood tests and also other scanning tests. And however, as long as I have taken the history from you, I think that there will be some DDs here, some differentials. I have some differentials that can be causing your symptoms. That since you have a heart valve replacement, okay, so at times this valve can get a bit infected, okay, and this infection can also cause some problems with your water work and also the symptoms that you're having. We call it infective endocarditis. This can be a cause, and also uh, and also uh, we might have this might be caused by some by some other infections as well, like tuberculosis. And since you also have some vague pain in your loin region, we might also have to exclude some cancer. You don't get bothered about it just at the moment, but we have to evaluate all these things. We will do some blood tests and also run some scanning tests, both of your heart and also of your kidneys. Okay, and we will also do some blood cultures. Huh? So after doing all these things, we will also involve the heart doctor, the kidney doctor, all of them. And after evaluating all these things, we will get to you as soon as possible, and make out a workup plan. Is that okay,
Okay, doctor.
Mrs. Erika?
So do I need admission?
Yeah, well, well, we can tell you after after examining you properly, that whether you need admission at this moment or not. Okay.
Yeah.
Okay. Any other concerns?
No.
Okay. So thank you, Miss Erika.
Okay. You have 1 minute to remain to gather your thoughts. Then we are coming back again. Okay, present your case.
Well, the patient, Miss Erika, actually has complaints about night sweats for the last 1 month, and also she also has some fatigue and weakness. I think for the last 2 months, and and she also has loss of weight, which is around 5 pounds in the last 2 months. Although he has, although it was unplanned. And on query, she told that she had some left-sided tummy pain, which is vague and non-radiating, and also some darkish color urination, and some darkish color urination. And she also tells that she has some moderate shortness of breath for the last 1.5 months, and for the last 1.5 months. And since she has a history of aortic valve replacement through mechanical valves, and although she has been on warfarin and it is regularly marked, but but considering all these things, I think that she might be suffering from a condition from infective endocarditis. I think, although there will be some other DDs, that tuberculosis can be a DD. Although she doesn't complain of any cough or any travel history like that, and also considering her darkish color urine and loss of weight, I think renal carcinoma should also be brought as a DD here.
Okay. Any abscess or any deep-seated infection?
Yeah, that can also be a cause of this kind of symptoms.
Okay. For nocturnal sweating and pyrexia, do you think any lymphoproliferative disease?
Yeah, I think I actually asked about some any lumps and bumps anywhere in the body. So this is also very much possible. However, I am not sure whether this darkish color urination, actually in lymphoma, it's a bit, I think, a bit rare, this darkish color urination. I'm not sure about it. But I asked about lumps and bumps anywhere in the body, and the patient refused.
It is just your differential diagnosis, not the true
Yeah,
diagnosis.
yeah. I could have brought it.
Okay, so how do you investigate her?
Okay, first I would do some baseline tests, including CBC with ESR and PBS, and also renal function test, and serum urea and electrolytes and liver function test. And then I would like to go on for some scanning test of heart, echo, ECG, and also a scanning of the renal tract, urogenital tract, including including ultrasonograph of ultrasonogram. And also I must do some blood cultures. I will take 3 blood cultures 12 hours apart to see whether there is any susceptible organism involved or not. And after doing the detailed examination, if I find any lumps or any lymph node, I might go on for biopsy of that lymph node. For biopsy of that lymph node, that's I think. However, I would proceed, and if any lymphoma suspected, then I might go for immunophenotyping, and that's all. And also, I will do the Monto test and some chest X-ray to rule out TB.
Okay, that was fine.
Okay.
And how would you treat her if it is a case of infective endocarditis?
How would you, sorry?
Treat her if it is a case of infective endocarditis.
Treat her. Okay. I would actually, it will depend on the culture and sensitivity report, because at times, usually the most common now, I think it's the common organisms, and whether it is resistant to the treatment or not, to drugs or not. But usually we can start with benzyl penicillin, and then other drugs can also be involved depending on the culture and sensitivity report and resistance pattern, like vancomycin and others also.
Time off.
Vancomycin, rifampicin, etc.
Time off. Okay, I am coming to some points that I should mention. That in the history taking, you have asked about fever, that she cannot tell you exactly if she has fever. Then nocturnal sweating, if she have noticed sweating at any time, what time of night does she feel that?
Yeah.
You should have asked.
Yeah.
And also for sweating, if it is a case of infection, then during that time, if she have any other symptoms, any pain or not. After that, in the history, in the general history, headache, any changes in the vision, that was fine. Any appetite, I already told you that I have lost appetite.
Yeah.
Okay, and also lost weight, and you haven't. I cannot remember if you have asked about thyroid issue.
Yes, I forgot to ask.
Okay, then in the chest issue for tuberculosis, cough, shortness of breath, also for heart issue, racing pacing, you have asked that. In the abdominal lump, you have asked that. Abdominal pain, you have asked that. That pain can be due to splenomegaly also.
Yeah.
Or inflammation in the spleen. Then then urinary tract, you have asked that. Well, that was fine. That changes in the color. Was there any signs of urinary tract infection? You have asked it. Well, any neurological sign, you have asked it. And in the past history, you have asked about in the past history. Okay, in the past history, you have asked it. Well, any recent history of trauma, injury, you have asked that. After that, in the medical history, have asked that. Well, that if she go to, I cannot remember if you have asked that if she goes to the heart doctor regularly for her valve checkup.
I told I actually focused on warfarin, but I didn't. I think I missed that. But I checked about the warfarin and INR more. I think I actually missed. I think that heart.
Okay.
Yeah.
No. And after that, any other past medical condition? There was no. Okay, that was fine. And what type of was replaced mechanical valve? That was under the history taking. In the drug history, you missed a very important part, that if she is taking any medication and also allergy. You haven't asked. Family history and then personal history. Personal history. You have asked smoking, alcohol. You have not asked about his her job.
Oh, yeah. Oh.
The intravenous tract, the tattooing. You haven't asked it. Oh, you have asked.
Intravenous I asked, but not tattooing.
Okay, sexual history, you have asked that. after that, I cannot tell you that more that you and also her family support you haven't asked, and also when she said that she has taken 2 antibiotics, you should have asked the name. You haven't asked that what type of antibiotic.
Oh, okay, okay, okay.
Was there any problem or did that help?
Yeah.
Okay, that is fine.
Yeah. Okay. And what about the DDs and other things?
That is fine.
Okay. And what was the case actually? Oh, may I know?
Hepatitis.
Okay.
And for
Okay. So I think that
patient need admission because patient need intravenous medication.
yeah. But should I tell it, because I was not sure at that moment that whether it's surely infective enteritis or not. So what should I tell in this type of cases?
Okay, that's a diplomatic answer.
So what I told, was that right? That first I have to examine you properly.
And for this lady, you haven't asked about her pregnancy, and also didn't ask pill and react.
Yeah.
Okay.
Yeah.
Bye bye.